Opening prayer. Almighty Father, creator of heaven and earth, we honor your name. We thank you for the gift of life and your faithfulness in providing our daily needs. Today, as we perform our duties as public servants, we humbly ask you, dear Lord, to guard our hearts and mind and to put the interests and welfare of our fellow men above all else. Make us more sensitive to the needs of those who have less in life and give us a listening ear to those attending today's deliberation as we search for the best course of action to face the pressing issues today. We entrust the remaining hours of the day into your hands and let your will be done. All this we pray in Jesus' name. Amen.
Yeah, Madam Chair. Yeah, I would like to move that we dispense with the calling of the roll, Madam Chair.
There's a motion and duly seconded. The calling of the roll is dispensed with.
Okay, Madam Chair, inasmuch as the minutes of the previous meeting has been distributed to the members, and I would like to move at this point that we dispense with the reading of the minutes of the previous meeting and approve the same.
Upon motion, the reading of the minutes of the previous committee meeting is dispensed with and the same is approved. Good morning, everyone. The chair would like to recognize the distinguished committee member who is present today. May I recognize and acknowledge the Honorable Mark Go, our Committee of Higher and Technical Education Chairman and a member of the Committee on Health. Good morning, Chair. Committee Secretary is now directed to recognize our esteemed guests and resource persons.
Good morning, Honorable Chair, Chair Go. In attendance for today's meeting are the following. From the Department of Health, Dr. Herna Manatad. Good morning, ma'am, and the rest of the technical staff of the Department of Health. From the Philippine Statistics Authority, Mr. Chodoro Ortesa and Attorney Jefferson Biado and the rest of the technical staff. From the Department of Budget and Management, Ms. Yvette Maclang. Are you around, ma'am? And Mr. Jethro Boa Cupino. From the Research Institute for Tropical Medicine, or ITM, Attorney Annalisa Duran. From the Food and Drug Administration, Attorney Emilio Olig. Morning, sir. From the Bureau of Quarantine, Dr. Carlos De La Reina. Morning, sir. And from the Department of Interior and Local Government, Mr. Robin Lim and Ms. Kristen John Aragon.
Good morning, Madam Chair.
Aragon Tomial, I'm sorry. And from the League of Cities, Ms. Reggie Santiago. Good morning, everyone. That would be all for now, Chair.
So once again, good morning. And our agenda today is a briefing of the Department of Health on the Philippines' capacity for surveillance and response to notifiable diseases, epidemics, and health events of the public health concern with the end view of strengthening the Republic Act number 11332, otherwise known as the Mandatory Reporting of Notifiable Diseases and Health Events of the Public Health Concern Act. The Republic Act number 11332 was enacted on April 26, 2019, only 2 months after the enactment of the Republic Act number 11223 or the Universal Health Care Act. Both laws are the landmark public health legislations that were immediately tested and assessed during the COVID-19 pandemic 1 year later. Sadly, the pandemic cost the country thousands of lives, but it also taught us valuable lessons in the healthcare delivery system, particularly in the management of infectious diseases. These are lessons we can now learn from that we would make our nation more ready and equipped in case of possible future epidemics or pandemics like COVID-19. We shall start today with a briefing of the Department of Health on the implementation of Republic Act number 11332 on the state of the country's capacity for surveillance and response to notifiable diseases, epidemics, and health events of public concern. We hope that the Department of Health can also give the committee an update on the latest viral outbreaks in the country, such as the human metapneumovirus or HMPV, which already logged 284 cases by the end of 2024, and as well as the emergence of Mpox or monkeypox virus. After the presentation of the Department of Health, we shall hear the views of the committee members and other stakeholders, and after the committee shall also consider House Bill number 3863, an act amending Republic Act number 1132 to make it more effective in addressing future outbreaks. So without further ado, the chair would like to recognize a representative of the DOH for their presentation. May we now call on Dr. Jerna Manatad, Director 4 of the Epidemiology Bureau. Doctor, you're recognized.
Thank you, Madam Chair. Good morning, everyone. I would like to present now the presentations for this meeting as requested. Next slide, please. Consistent with the Republic Act number 11332 and its revised IRR, the Department of Health, through the Epidemiology Bureau, is the technical authority for disease surveillance in the Philippines. All notifiable diseases and health events of public health concerns are mandatorily reported to the Epidemiology Bureau or its epidemiology and surveillance units. Next slide, please. Most reports of notifiable diseases and health events of public health concerns are captured through the Philippine Integrated Disease Surveillance and Response System of the department. Next slide, please. To protect the country against public health threats, the Philippine Integrated Disease Surveillance and Response System serves as the early warning and response to epidemics and health threats in the country. This is subdivided into capturing cases for notifiable diseases and those that capture health events of public health concern, such as diseases outbreaks and clustering of cases. Both of these systems serve as early warning systems to rapidly notify the health system for adequate response and coordination mechanisms. Next slide, please. Local surveillance systems contribute significantly to the nationwide analysis of health data. The timely and efficient flow of critical health information supports public health decisions both at the local and national levels. For case-based disease surveillance, detected cases that are identified as immediately notifiable at the disease reporting units are reported simultaneously to the province, city, region, and epidemiology bureau within 24 hours of detection by the fastest means as possible. Initial reports can be verbal using the telephone or cell phone or via email. This will be followed by case-based reporting form using the standard Philippine Integrated and Disease Surveillance and Response Case Investigation form. On the other hand, weekly notifiable diseases are reported from the disease reporting units to the next higher epidemiology and surveillance units. Next slide, please. Now, EB or the Epidemiology Bureau manages the following public health surveillance information systems: reporting of pan-respiratory cases such as the SARS-CoV influenza-like illnesses, and severe acute respiratory infection or SARI is done through this system, the Tanod contra COVID surveillance system. All other diseases under the case-based surveillance and captured health events such as clustering are reported through the Philippine Integrated Disease Surveillance and Response Information System. For surveillance of adverse event following immunization, the cases are reported through the VigiFlow as managed by FDA, and adverse event following information system as managed by the Epidemiology Bureau. For our specialized surveillance systems, we have our surveillance systems on HIV and other sexually transmitted infections. We also have our online surveillance systems for priority injuries, and we also have our surveillance system for tuberculosis. We also have the Field Health Service Information System for the monitoring and evaluation of public health programs. With this, Madam Chair, this is the systematic way of how the Department of Health, through primarily the Epidemiology Bureau and other critical bureaus, helping us boost our national health security through surveillance and outbreak response. Thank you, Madam Chair.
Madam Chair, can we ask some questions on the presentation?
Yes, yes, Representative Go.
Yeah, thank you. Thank you very much, Madam Chair. I would like to know from Dr. Manatag, with your presentation, how do you evaluate the performance of your unit or DOH in terms of the effectiveness of these items that you presented in the many cases that we have during the last few years?
Yes, Dr. Jonah.
Thank you, Madam Chair. Based on the presentations and how do we also evaluate, I would like also to clarify the questions on the effectiveness of the Bureau in doing the surveillance and outbreak response. We have our matrices and our guide and then indicators to evaluate how sensitive and specific and responsive this system is. So we have a criteria for that in terms of the functionality also of our surveillance system, down not only at the Epidemiology Bureau, but also down to the province, to the region, province, and also to the local government unit. Now, since we classify the diseases as Category 1 and Cat 2, so for Cat 1, these are diseases that should be notified within 24 hours. And these are the list of the cases. We have the system that could capture those diseases through our event-based and surveillance system, and also through our case-based surveillance systems. So the diseases that should be captured within 24 hours is an indication that yes, the surveillance system is sensitive enough to capture those cases that should be notified within 24 hours. Now, for the diseases classified as weekly notifiable on a weekly basis, this will also tell us that yes, we are capturing the diseases based on the classification of the disease. So we have a report based on the trend and based on the diseases captured by the system. We can say that the system is sensitive enough to capture these notifiable diseases, Madam Chair.
Chair Go, did Dr. Jonah answer your
I
query?
think we'll have other presentation. May I give them the Yeah, I think
Dr. Jerna, may I know if anyone here aside from you would be able to discuss to us what is exactly happening within the system? Because all we have received was the response of having a system just to surveillance, but the system itself, would there be an among you who can discuss that, how it happens? Like, for example, an actual disease that was notified by the system, but how is that system? How is that communication? Is it digital? Is it verbal? How many people are involved in that? Will there be anyone among you, or only the DOH can explain that?
Madam Chair, we can go back into the second, the slide, the flow of capturing and how the process of doing the surveillance and who are involved in doing the surveillance. We can describe it more through the presentation.
They still have what page in the presentation was that, Dr. Jenna? In the meantime, may I first recognize another member of the Committee on Health. We have Honorable Steve Chongbian Solon of the Sarangani Long District.
Please,
I think what you presented is the theoretical process that you follow in terms of the surveillance, monitoring, and actual addressing of these particular diseases. What we'd like to know is, as stated by our chair, we'd like to know how do you trigger all of this? Yeah, yeah, like the monkeypox.
Yes, sir.
We can have a specific case.
We can, Madam Chair, if I may allow, we
Yes, Dr.
can
Jenna.
further describe the process on slide number 5. Where is yung my case detection, case registration? Please guide. Yes, yes, Madam Chair. Okay, so this is really how the process in terms of its application in the ground and at the implementing units. Now, since surveillance really is our first line of defense, so we need really to discuss as to what's the process in the implementing units. Now, we have classified Category 1 as immediately notified diseases within 24 hours, and also Category 2 as diseases that should be notified within within a week. Now, based on the list of the diseases guided by the law and what is Category 1, so example po is a case of Mpox. Yes. By the moment, so we have a lot of sensors or areas or health facilities or clinics or hospitals that could capture the event or the disease. Now, if there's an Mpox now case or a patient going into a hospital or on an outpatient clinic or to a rural health center or to a barangay health station at the lowest unit, Madam Chair. Now, our network or our disease surveillance units and our disease surveillance officers, our hospitals are oriented on the description of when can we consider this case as an Mpox suspect Mpox case because there's no laboratory yet. So based on the clinical presentation of the case, so the attending physician now or the health worker now confronting or managing or attending to the case because they are trained to this definition on when are we going to classify this as a suspect Mpox case. So this process now, based if this will enter into this disease reporting units, or we called it sensors, or clinics or hospitals, so they can detect a suspect Mpox case now through our attending physician and our health workers.
So let's say we have a clinic in Baguio
Yes, sir.
that is,
Yes, sir.
probably initial evaluation, they suspect that this case is more of an Mpox. Then what will they do?
Okay,
Do they report to the to the city health department? Then from the city health, it goes to the regional office of DOH.
yes,
Can you?
yes, sir.
Meron ba tayong flow chart
Yes,
that
sir.
will show that one?
Okay,
Oo.
so we can also share the flowchart specific on Mpox because we have a guide. The
Yes, Dr.
process
Derla,
flow.
can you please share that?
Our technical team, can you, through the to see the Mpox, just for us also to easy to follow the
Yes,
process.
Yes. Please post the page. Yes, Rep Solon.
While they're putting up the slide, so ma'am, yung sensor nyo will emanate from the barangay level or the LGU level, di ba? Person ba yan?
Yes, sir. There are, thank you, Madam Chair. There are a lot of sensors based on the surveillance. It can go through a barangay health station or a rural health unit or a private clinic.
Okay.
So
I
there
see.
are multiple sensors that can be captured by us disease surveillance unit, and that's the epidemiology and surveillance unit in terms of the flow.
When you say sensor, it's a physical thing.
At the moment, sir, yes, it's a physical thing. Although we have also used the blue dot, and that we have a system that can also be our source through this technology. So we have physical and we have also
Saan
used.
nyo linalagay yun? Oo.
Okay, yes, sir.
So you have a sensor. When you say sensor, it's a device that determines, for example, what kind of probably disease or what.
So right now,
Meron kayong
sir,
sensor na physical ba yan? That's why I was
it's the
asking.
human sensors. Human.
Ma'am, yung nabanggit nyo kanina, Madam Chair, when I asked you what sensor was, you said, nabanggit nyo health facilities.
Yes, Madam
Tama,
Chair.
So hindi siya tao, hindi siya BHW, hindi siya barangay nutrition scholar na nag-i-inform sa, when you say sensor, you mean health facility like barangay health station or municipal hospital, ganun ba? Ano ba talaga yung sensor?
Madam Chair,
Yes,
to
Dr.
clarify,
Jonah.
although we are sharing this terms that we use in the surveillance, but when we say sensors, these are the reporting units composed of an individual persons trained to detect notifiable diseases.
So
Yes, sir.
yung sensor nyo, I think you need to use a different word. Kasi sensor, for example, I came here, there is a sensor that will measure that
Okay.
1 or 2 people entered.
Okay.
And when he leaves, a sensor will tell us that the
Yes, sir.
person left already.
Thank you
Something
for
like that.
allowing us to clarify what sensor is in our parlang in the district surveillance. So that's how we describe that this health facility can detect through our trained disease surveillance units team. Okay.
Okay, ma'am. So
Yes, Rep Solon.
yeah, Madam Chair, wala pa yung flowchart kasi gusto ko din makita yung sabi ni Kong Go.
Chart.
Yeah.
we have really a clear flow chart because by that time, Madam Chair, that WHO declared that as a public health of international concern, the Department of Health, through the critical bureaus and concerned bureaus, really crafted a national action plan for the control and prevention
Yes.
of Mpox, and we have a clear process for this.
Yes, ma'am.
Yes, Dr. Jenna, now we have the flow chart. May we ask you to explain to us?
This
So
one.
for now, as we heard earlier, hindi pa ba ito yung flow chart? Iba pa?
Specific for Mpox, we can have that specific for Mpox, but for the general classification of the disease classified as CAT1 and CAT2, this is the general process.
So as we understood earlier, Dr. Jenna, we heard you say that a sensor does not technically mean that it is a machine. It's more of a person who will be notified by a certain individual who is actually infected by that certain disease. For example, earlier on, we also requested for an exact, a specific sample from the Mpox, but soon after, siguro, should we wait for that, or we can go on? Maybe other resource persons can also have any more inputs while we wait for that sample. But technically, now we are clear that the sensor does not technically have to be a machine. It's more of a person or an individual that we actually describe as the disease surveillance officer, who will be the one to detect it. But later on, we will be asking further clarification on this, considering that we do have several barangays, and in that barangay, how do we actually train everybody to know or detect a specific disease, di ba? Kasi that would be we need to clarify. We can have these officers available in all of our barangays, especially medyo baka kumalat na yun by the time we understand what the disease is all about and how we quarantine a particular patient or individual who has that kind of disease. Minsan, di mo pa nga alam, lagnat lang, meron na palang disease. So we'd like to know, how do we exactly identify a particular disease? Dr. Jonah, do we already have it, or eto na po? Sige po, salamat po.
So, can I just cite a very specific case? For example, there is a patient that went to a public hospital, let's say at the Baguio General Hospital. Okay, para maano natin, ma-conceptualize natin, a patient feeling something that I do not, feverish siya, pumunta sa doktor, at hindi ma-diagnose ng doktor. Pumunta siya doon, hindi ma-diagnose. Binigyan siya ng lab test muna, then they found out that there is something, Mpox. So from there, anong gagawin niya? Anong gagawin ng doktor? Ano pong gagawin niya under your, bibigyan ng gamot, siyempre, o re-refer niya, mayroong consultant na tatawagan para pagtulungan. Kasi kung hindi naman expert yung doktor, o kaya hindi niya alam kung ano yung sakit ng tao, but meron siyang mga signs that are gearing towards ito nga, identification as Mpox. Yung po mga doktor na pupuntahan, meron na silang ganong training ba? Alam na nila? At kung meron man, saan pong lugar ito? Is this a nationwide, program na alam nila?
Yes, sir. Okay. Opo. So, thank you, Madam Chair. Can I be allowed now to explain the process specifically as raised by Honorable Go? Let's have a specific area and disease, a case. So this is the management pathway or our referral guide for our network across the country. Now, in an example, if a patient consulted a certain hospital And then as mentioned by Honorable Go, in Baguio General Hospital. Now, the point of entry could be at the emergency room or at the outpatient clinic. If the patient will have its entry at the ER or at the outpatient clinic, so this will be the process. The attending physician shall screen the case. If what this case would be in terms of its assessment, what is the initial medical diagnosis of the case. Now, based on the guide, because we also really thoroughly oriented all our hospitals and all our primary care facilities, they also have the guide. So, when are we going to say that this is a suspect Mpox case? Now, if patient is classified as suspect or probable Mpox case, there are also description and criteria when this patient can be classified as suspect or probable. Now, if the patient is classified based on the right side, uh, for me on the left side, patient classified as suspect or probable Mpox case. There is a standard case investigation form that should be filled up by the attending health worker. Notify immediately the local epidemiology and surveillance unit since Mpox is classified as notifiable within 24 hours. Now, the patient should be referred for specimen collection for confirmatory. And right now, we are also have our RITM has the capacity to confirm that for a case as Mpox confirmed case using this technology, and that's PCR testing.
Madam Chair, para tuloy-tuloy to. Let's say, suspect yan. Meron pa tayong office sa within DOH of the region, dun siya pupunta. Meron po kayo. Alam na nila ngayon yun. Yung RITM kasi nasa Manila yan eh. Oo. Pero limbawa sa amin po, sa CAR, sa Baguio. So, if a doctor suspects na itong pasyente ito may Mpox, pupunta siya ngayon sa isang opisina sa inyo po, sa Baguio. Meron din po doon. DOH.
Yes, Madam Chair. To answer po the additional query of Honorable Go, at the DOH Baguio, we have our regional epidemiology and
Okay.
surveillance unit. Now in Baguio City, we also have our Baguio City epidemiology and surveillance unit.
Okay.
And in the hospitals din po,
So, pag nandun yung epidemiologist ninyo sa Baguio, ito pong doktor na ito will, anong gagawin niya?
the doctor in the BGH, Honorable. Okay, the doctor or the attending physician in Baguio Gen will through its process within the hospital,
Okay.
since they also have their laboratory.
Hindi, huwag nyo lang yan. So,
We have to collect
okay.
a specimen
Can be
and then
tested.
notify CESO, the Baguio, to facilitate the transport of the specimen to RITM.
Tagal yun. Oo, tagal yun. Ilang,
We have our RITM, sir. They can also slide on the turnaround time.
Yes, we would like to, before we proceed, I'd like to recognize another member of the Committee on Health from the 6th District of Bulacan. We have Representative Salvador Plato. Good morning, sir. Okay, so now we would like to recognize the Attorney Ana Liza Duran, doctor from the Research Institute of Tropical Medicine. Director Anna, you are recognized.
Thank you po. Thank you, Honorable Chair. The Research Institute for Tropical Medicine can do the PCR testing for monkeypox. During the Mpox, we already trained also subnational laboratories, and Baguio General Hospital Medical Center is one of the trained hospitals where they can do the PCR testing. Other hospitals that were trained to do the MPACs were Lung Center of the Philippines, San Lazaro Hospital, Southern Philippines Medical Center, Visonto Soto Medical Center, Western Visayas Medical Center, Bicol South Luzon Subnational Reference Lab, Jose Bilingad Memorial General Hospital, and also East Avenue Medical Center.
So, meron po kayo. Ngayon, sinabit na-test na yung tao, confirm meron siyang Mpox. Ano ba ang next process natin?
If the patient is confirmed to have Mpox, they will have to determine if the disease is mild or uncomplicated or complicated.
Yes.
So the infectious disease consultants who are assigned in the hospitals will know how to deal with the management of the cases. If the cases are only mild and uncomplicated, they will be sent home for
Okay.
home isolation.
Okay, so they can treat them right there and there, in other words.
Yes po.
Okay, regardless of whether it's mild, ano pa, moderate, serious,
Severe,
or
yes po.
severe.
Yes po.
So,
They
kaya
have
po
to
nila
treat.
doon.
Yes po.
Okay, ayun. Thank you, ma'am.
Thank you, Chair Go. Is there any other member who would like to continue on with the line of questioning with our ITM director? Okay, so to proceed, no, may we also recognize other resource persons? May Attorney Ana Liza Duran, would you like to continue on with your presentation, considering that we already recognized you? Do you have a presentation for us?
Ma'am, we do not have a presentation. We will just be supporting other reports of the Epidemiology Bureau. Thank you po, Honorable Chair.
Thank you so much, Director Ann. May we now call on the Director Ferdinand Salcedo from the Bureau of Quarantine. You are recognized, Doctor.
Good morning, Madam Chair. I'm representing Director Ferdinand Salcedo, Deputy Director Roberto Salvador po, from the Bureau of Quarantine.
Yes, you may proceed. Do you have any
We have no presentation, but we are supporting the presentation of the Epidemiology Bureau po. Thank you.
All right, thank you so much. May we proceed and recognize our representative from the Food and Drug Administration. We have Attorney Emilio Poling Jr. Director Emilio, do you have any presentation? Yes, sir.
Good morning, Madam Chair. Likewise, we don't have any presentation insofar as related to the presentation of our colleague from the DOH. Our manifestation would be related to the bill sponsored by the good Congressman, Madam Honorable Chairman. Thank you.
Madam Chair, may I?
Yes, Chair Go.
Before we go into the bill of Congressman Gaston Bunting, meron pang dalawa. Okay, okay.
Sige po, salamat, Chair Go. May we also hear from Mr. Robert Lim, the Program Manager of the Department of Interior Local Government of the Central Office of Disaster Information Coordinating Center. Do we have the Program Manager, Mr. Robin Lim?
Yes, Madam Chair. Insofar as for the presentation, we have no presentation, but we have few manifestation on the bill.
Yes, go ahead, Mr. Lim.
Insofar,
Mamaya pa, for the bill pa kayo. All right, do we have anyone else? Or do we have Ms. Reggie Santiago, the Program Officer of the League of Cities of the Philippines? Do we have a presentation from your office?
Good morning, Madam Chair. Unfortunately, we do not yet have the presentation regarding the briefing of regarding the Philippines' capacity for surveillance. However, I would like to manifest in support of the DOH that local government units already have their epidemiology and surveillance units. We have select cities as well who have turned these units into divisions already. So I think for local governments as well, we are ready to support whichever amendments are needed to strengthen the ESUs in local governments. Thank you, Madam Chair.
Thank you so much. So we are now going back to our chair, Go,
Yeah,
for your
yes, ma'am.
additional.
In other words, the Department of Health is capable to address based on what our Dr. Manatag mentioned, uh, any disease that will arise in the different parts of the country, we have a structured system where we can really monitor, do surveillance, and act on them real time. Tama po ba yun based on what you're saying? Pwede po ba nating siguro part of the ano dito, if we can publish itong mga ganitong kasi like Baguio General Hospital meron pala. And that is catering saan? Only Baguio or it caters to the whole of Cordillera or Northern Luzon? Just like the other kasi ilang po lang nabanggit kanina mga a few of these. So probably where do they go if something happens like this? Thank you.
Yes, Doctor, you are recognized.
Thank you, Madam Chair. Now, based on the law and based also on our monitoring capacity building and also based on the output now of the surveillance system, all local government units have their epidemiology and surveillance unit. Now, in terms of its capacity, this is where the dynamics are and the variations are. But we have also the list of those full functional surveillance units, and we also have the list for those we need to upgrade local government epidemiology and surveillance units. So it's a progressive way of capacitating really our local government units as well as our hospital facilities.
Any follow-up, Chair Go? Yes, Chair, Rep. Salon.
Maybe Chair Go had something or
Chair,
You are telling us that there are more than 1,000 municipalities in the whole country. There are about 82 provinces and more than 100 cities. All of these have epidemiologists. Bawat isa po meron sila.
Madam Chair, we can share you the list based on the functionality assessment and the special trainings and expertise that we have
Ang
across.
gusto ko pong tanong, lahat po ito meron o ano po yung baka naman hindi lahat
Okay.
siguro.
We can share the number of local government units based on the assessment through
Okay.
our system. We can provide and
Okay.
also the current number of
Mga ilang pong porsyento
epidemiologists.
meron based on your assessment? Ilang porsyento?
Chair Go, may we recognize Mr. Guillermo of the DILG. I think he has some data on
Okay.
the numbers that we are asking for.
Thank you very much, Madam Chair. Insofar as the functionality of the local epidemiology and surveillance unit in the country, this is based from the recent assessment of the Seal of Good Local Governance. And our data actually stem from the Department of Health scorecard. Now, for the entire country, we are pegging at around 64.37% of all local government units with functional local epidemiology and surveillance unit. Now, to break this down further, for the provinces, that's around 83.95% or 68 provinces have functional LESU. For the cities, it's around 85.23%, around 127 functional LESUs. And for the municipalities, we have 61.21% or 909 with functional LESUs. We'll be providing the figures to the committee, Madam Chair. Thank you.
Thank you so much, Mr. Lim. Chair Go, okay na po yun.
Thank you very much for the information. I think this will guide us in our proposed bill of Congressman Gaston Buting.
Thank you so much, Chair Go. Yes, Rep. Salon, yes.
I just want to add, ma'am, I think COVID would be the best example Because nangyari yung COVID, nakita natin yung mga gap sa sistema natin. Tapos in the last 3 years, you guys have strengthened it. And I want to commend the DOH because very maganda na yung reporting system. And so I just ask that you keep everything tight, right? Because I think, I'll give you an example. Maybe we have, let's say, monkeypox or chikungunya, let's say, they are infectious, but they're not as infectious as COVID, correct? So, mahahabol nyo kung may sakit, pwede nyo i-isolate, so on and so forth. Nakikita ko yung problema dito sa baba is, even if we have these lesus, sometimes they lack the kits to test on site. Tama? Because they have to send everything to our ITM. I'll give you an example. Someone in our household was suspected of getting chikungunya. So this is from mosquito, parang dengue ito. So ang nangyari is, we could not test whether it was chikungunya or not because the hospital did not have tests. No kits, right? No kits. Do you have it in RITM? Because I know they say they have to send it to Singapore or something to validate. RITM has it. So I think that's one gap that needs to be filled. If there is a infectious disease na madaling kumalat, dapat sa LGU mismo meron kayong available kits para ma-diagnose na doon. Kasi monkeypox, makita mo may mga butoy-butoy, di ba? May mga physical, No, so maybe that's one thing that you might need to tighten is to capacitate the barangay and LGU level that they can diagnose on the spot and then isolate. Thank you, sir.
Yeah, I think that
Thank you.
just like what happened sa COVID, after a while, before we were sending everything to our ITM, it takes long. But after a while, when the kits were developed and introduced in the different parts of the country, real time, kahit na individual, they don't need to go to the doctor. They just, test themselves, and they can determine whether they have COVID or not. So I think we can do the same by capacitating them and providing them, of course, the material kung pwede natin gawin yan. And that would require budget on the part of the Department of Health. And probably PhilHealth can, yeah.
Especially very infectious.
Yes.
Yes, Director Annalisa.
Madam Chair, if the disease is already known and there is already a gold standard for the diagnosis of the disease, then it will not be difficult for everyone to use the gold standard. However, for novel diseases that have not yet they have not yet discovered the gold standard for the diagnosis, and for example, they will still have to develop the kits. So that's the time that we have a problem, and it's not only nationwide but also global in scenario whereby, for example, in COVID, they have to develop the kits. That's why there will only be, like, for example, a particular laboratory that can diagnose it at first because the kits are not yet distributed to the different areas. So after a while, when all the kits are able to, all the kits were already developed and they were validated to really diagnose the particular disease, then the price of the kits and the availability nationwide and globally becomes big or wide. So that at particular time, the kits and will now be available anywhere else in the country and in the world. So that's what happens po. Thank you po.
Thank you, Attorney. Do we have any other questions regarding this? From the chair, no? Mag-ask lang sana ako, Director Anna and Dr. Jerna, whoever can respond to my question. Knowing that we already have this kind of system, knowing sino yung first officer to respond to an individual who is suspected of any disease, I'd like to know gaano ba kabilis, how quickly can we respond to a certain disease? For example, some of our kasama natin, mga tao, minsan konting ubo, konting sipon, wala na yan. They don't really want to talk about it. Some of them don't even cover anyone. But how do we know if one is infectious? For example, saka pa nila isipin it's serious when they have the fever. Diba? Minsan kasi when you have fever, your body's already fighting it off. But then again, some of that, kailan ba nagiging infectious ang isang disease? Kung may fever lang ba or during the time na nagbibigay na siya ng simptomas katulad ng ubo and sipon or sore throat, it all comes to that point also for the buto-buto, the spots that you see all over the body. Sometimes isipin na, hindi lang, ordinary measles lang yan. Because I went through the whole thing. Wala akong kahit na isang vaccination and growing up, and I went through the whole thing and knowing na some of them are actually, communicable. So all 7 of us siblings, kinukuha namin lahat ng sakit na yan. Pero just because wala kaming vaccination. But we went through all that normally. Pero mga diseases coming from other countries, the quickest was how fast how did we recognize Mpox when it came from outside of the country? How fast was that? How long did it take for somebody to actually recognize that, considering na infectious na pala siya? And how do we tell everybody? Do we have, parang hindi ko na yata nakita dito sa ating flowchart, how it was communicated for the rest of the country. Say, for example, that individual actually went to other provinces before he went home. And we don't even know na baka nasa katawan na pala niya and then emitted throughout his fluids. So, Dr. Jerna and Director Annalisa, how quickly do we respond to this, especially then, of course, it's normally coming out from a different country? Thank you.
Thank you, Madam Chair. Now, if the diseases is coming from other country, we also have the system to capture as much as possible as early as we can. Now, that's through the Bureau of Quarantine. And maybe, Madam Chair, we can also ask BOQ as to the process.
Thank you, Dr. Jerna. May I recognize Dr. Salvador?
Good morning uli, Madam Chair. So the Bureau of Quarantine po has an intact system po in screening travelers from international community. So we also have our international health surveillance headed by our division head, Dr. Caloy, wherein every day po nagagather kami ng mga information from international sources like Blue Dot. So once we detect a cluster of cases na merong possible na makarating dito, so we alert our officers and Secretary of Health so para po makagawa po ng regulation. Pero po ang Bureau of Quarantine po from since the start of SARS po, continuously po nagmo-monitor po. We have thermal scanners, secondary screeners. So once po na pumasok po ang travelers natin na meron pong fever or other physical signs and symptoms particular to a disease, so now hold namin siya. And once po ma-hold namin, so ma-classify namin as suspect, so ni-refer po namin siya sa referral hospital natin like RITM here in Manila po.
Thank you, Doctor. Yes, Rep. Solon.
So anyway, yung alam ko may thermal scanners kayo sa airport, di ba? Pero ipon nabanggit mo kung may mga signs and symptoms ang traveler, you're able to single them out and find them. Pero tingin ko, that's not true eh. Yung fever, okay, kasi makikita mo sa scanner. Pero kung may, nakabiyahe ko, ang daming may ubo, ang daming may no? Hindi natin ma-hold yan. No? So I just need to know exactly, is it only the thermal scanner that you have, or do you have people on the plane informing you, ato seat number 2D, may ubo at sipon, seat number, meron mga ganon or wala?
Yes sir, Madam Chair. Meron po tayong tinatawag na health declaration checklist na naka-embedded na po dun sa e-travel system natin. So before traveler po they will enter the country, they are mandated po to fill up the health declaration checklist. Okay, so syempre po, limited din po yun na dapat po truthful yung sasabihin ng traveler. So marami po talaga nagsisinungaling. Kaya importante po will be the right information na binibigay natin sa traveler, especially po pag meron tayong nakikitang sakit sa particular country. Kasi po, because of the learnings po ng mga tao dito sa COVID po natin, so yung right information po will tell them how to protect themselves na magkaroon at mauwi yung sakit dito po.
Madam Chair,
Yes,
I must apologize because I have to attend another committee, but I just like to throw this out to DOH or whoever. What's your opinion on getting the population more responsible with a campaign na if you are sick or may ubo ka, just wear a mask or don't go or something like that. Kasi maganda na yung kampanya natin dati. Kung may nararamdaman ka, kung maski hindi COVID yan, may sore throat ka, mag-mask ka. Diba? I mean, how do you feel about that campaigns? Alam ko, Chairman Go and Madam Chair, Japan and Korea, they do that. Kung inuubo sila, yeah, something like that ba? Because I mean, that's, you know, we were using the buzzword during COVID when everyone was afraid, new normal, new normal. Ngayon wala nang COVID, balik sa dati. Pero the new normal should be, di ba? It should be like that, Doc, di ba? I think, I bring my mask. If I go to the elevator, I put my mask on. Yeah. So, and yeah.
Thank you so much,
Meron
Representative.
akong,
Yes, Chair.
you know, now that everybody's traveling, ang dami nating nagta-travel left and right. After the COVID, everybody wants to travel. Siguro isa pong suggestion in addition to what was suggested by Congressman Solon is i-monitor natin yung development ng mga cases in other countries so that when we inform our people, we can tell them exactly, oh, in Singapore or in Malaysia, these are the cases. Please avoid, this kind of, you have to wear this, that in visiting these places. Kasi there are cases obtaining in these areas or in these countries. Para alam ng mga traveler eh. Ang mga traveler, pag pumasok ka sa Pilipinas, yung health declaration, isa pang trabaho yun eh. Hindi naman nila yun eh. And we will ask them to take responsibility first on their health condition. And let's not put the burden to the country or to the government yung pag-aasikaso sa health ng tao. Dapat sila muna eh. No? Protect themselves. Pag ikaw yung nagka-travel, you want to travel, you have to be sure that you are healthy. Wala kang, you prevent yourself from contaminating yourself also. Yun ang palagay ko isa dapat natin gawin. Then we can have a highlight warning, if you may, sa lahat ng mga traveler, if you're visiting itong mga countries na ito, avoid in crowd or whatever. Pwedeng advisory kung ganon. Para maiwasan mo natin yung, kasi pag pumasok na ngayon sa isang tao rito, then he contaminates other people, it will spread like fire. Yun lang, Madam Chair.
Thank you, Chair Go. Do you have a response to that, Dr. Jenny? Yes.
Thank you, Madam Chair. Now with that, we also would like to share and emphasize also the current system that we have. We have the Bureau of Quarantine. At the Epidemiology Bureau, we also have our International Health Regulation and External Unit who also have the responsibility really to notify WHO IHR Secretariat on the diseases which have an public health international concerns. So these are the diseases that should be reported and to be shared outside the country. The same thing, other countries also are doing, report that to the WHO as IHR, and that case also will be shared across the member states. Example, if one case passed through our point of exit and the case was detected in Saudi Arabia, example, now the IHR focal point for Saudi Arabia will notify WHO and now will notify the epidemiology Epidemiology Bureau of the Department of Health for further response, particularly contact tracing and other control measures. So that's also the system that we have right now, Honorable Chair.
Sige po, Dr. Jenny, thank you so much for that. Do we, maybe, okay, so we will now recognize first our, another member of the Committee on Health, Honorable Gaston Bunting of the Parañaque City Second District. We will now proceed with our agenda, which is the deliberation on House Bill number 3863, entitled An Act Amending Republic Act number 11332, otherwise known as the Mandatory Reporting of the Notifiable Diseases and Health Events of Public Health Concern. The chair would like once again to recognize the author of the bill for his sponsorship, and thereafter the chair shall also call on different resource persons to present their positions. And after this, the House members may also direct their questions to our guests. May I now recognize once again Representative Gustavo Tambunting.
Thank you very much, Madam. Amending the Republic Act 11382, otherwise known as mandatory reporting of notified diseases and health events of public concern Act. The COVID pandemic has allowed us for the early evaluation of the said law, revealing areas for improvement and amendments. While some provisions are not yet fully implemented, the gaps in the current response show that the provisions of the law would have been particularly helpful in controlling the spread of the diseases. The proposed measure, Madam Chair, seeks to augment this law and to make more effective in addressing future outbreaks by establishing subnational laboratories in all DOH-run hospitals. We also seek to establish hotlines and other forms of access for responding to these diseases. And number three, requiring DOH to issue clear guidelines as soon as possible for the systematic reporting of these diseases. And four, requiring all public and private institutions to provide the necessary information campaign for the disease in surveillance and other epidemic investigations. Again, on behalf of the people of the second district of Parañaque, and of course for the good of the Filipino, I ask that the committee consider this proposed bill 5163. Thank you very much.
Thank you so much, Rep. Gus Tambunting. May we now have our resource person to respond to the House Bill of Representative Tambunting on Republic Act, amending the Republic Act number 11332. May we first call on Dr. Jonah Monatag. Thank you.
Thank you, Madam Chair. Now, with this, the Department of Health is supporting the amendment of the Republic Act 11332, and we will submit the official and approved position paper of the Department of Health. Thank you, Madam Chair.
Thank you, Dr. Jonah. May we now call on the Director, Attorney Annalisa Duran of the RITM to respond to the bill.
Good morning, Madam Chair. Likewise, the Research Institute for Tropical Medicine is also supporting the amendment of Act 11332 by House Bill number 3863, which is the mandatory reporting of notifiable diseases and health events of public health concern. As to the Research Institute for Tropical Medicine, we are the technological support of the Department of Health as to the diagnosis of all all the diseases, the notifiable diseases of public health concern through our laboratory research division. Thank you, Madam Chair.
Thank you, Director Anna. May we now call on the Food and Drug Administration Representative Attorney Emilio Polig Jr.
Thank you, Madam Chair. Good morning once again to this honorable committee and to the other resource persons present. Likewise, insofar as this measure aims to further enhance our response strategy for epidemics or of national concerns, rather local or national concerns, the Food and Drug Administration, in behalf of my principal, fully supports the enactment of this bill, Madam Chair. We will present our position paper, formal position paper, but if we could be allowed to manifest our initial manifestations, I can proceed, Madam Chair.
Go ahead.
Yes, Madam Chair, our observation deals on the amendment of Section 7 of 11332, insofar as inserting the phrase or sentence in bold letters. Number one, Madam Chair, if I may read, the Secretary of Health shall have the authority to declare epidemics of national and or international concerns, in which case the Interagency Task Force for the Management of Emerging Infectious Diseases, created under Executive Order 168, shall immediately convene. The President of the Republic of the Philippines shall have the authority to declare a state of public health emergency upon the recommendation of the IETF or upon declaration of the WHO of a public health emergency of international concern. The state of public health emergency shall authorize the President to mobilize governmental and non-governmental agencies to respond to the threat and to exercise measures provided in RA 101-9121 when a state of calamity exists. Just 2 points of initial observation, Madam Chair. The provision states contemplates of 2 scenarios where it triggers the declaration of the President to declare a public health state of emergency. Number 1 is when the Secretary of Health declares epidemic of national and or international concerns. And number 2 is when the WHO declares a public health emergency of international concern. We're not questioning the wisdom of the how it's presented, but probably if we could, in all likelihood, if WHO, considering that DOH is in close coordination with WHO, even prior to the declaration of the WHO of a public health emergency, maka yung mismong secretary po ang magano, kasi the message here is that if it is the secretary that declares a national international concern, it will convene the IATF. But if the WHO will declare a public health emergency, it seems na no more walang engagement ang IATF, though it's presented, I mean, how we read it. So most likely, baka kailangan medyo i-tweak lang. Baka yung declaration of WHO will form part as the trigger for the Secretary of Health to declare a public health emergency. In that way, the IATF will now be convened. That's one observation, Madam Chair. And second is that the authority of the President to mobilize government, non-governmental agencies to respond to the threat, referring to RA 10121, which is the NDRRMC law. We would like to respectfully suggest as well to insert RA 11517, RA 11517, that is the authority of the President to streamline the regulatory processes or even suspend the requirements in cases of public health national emergency. And to add, to give more legroom, apart from RA 10121 and 11517, we may suggest that to include a phrase and such other laws as applicable, so that to to include other laws that may be enacted even before the enactment of this bill, Madam Chair. That's all, Madam Chair, for now. Thank you.
Thank you so much, Attorney. Before we proceed,
Yeah.
may I recognize first
Okay.
our another member of our Committee of Health. We have Honorable Bonifacio Bosita of the One Rider Party List. Good morning.
Senator of the-
Good morning po.
Good morning po. Yes, yes, Chair, go.
Yeah, I would like to clarify yung binanggit ng natin, resource person. You were saying that if this will be the triggering point is the declaration of the World Health Organization. Do you have objection with that? That anyway, the World Health Organization declares it globally naman eh. It's not specifically for a particular country.
No, it's,
Okay.
we're not questioning the wisdom of it, Madam Chair, but the procedural aspect of it, since if the WHO declares it, the President can automatically declare a state of public health emergency without even convening the IATF.
That will be, of course, the president will not just,
That's right, that's right.
yeah.
That's why I said a while ago, Madam Chair, that most likely kung may WHO declaration naman ano naman talaga kagad sa Department of Health. So matritrigger kagad ang WHO naman, I mean ang DOH din naman kagad.
Hindi, nakalagay naman dito, it's very clear that the President of the Republic shall have the authority to declare a state of public health emergency upon the recommendation of the AITF, EID, or upon the declaration. So the President has all the option. And even if there is a declaration by the World Health Organization, the President may not declare a state of emergency as he determines based on recommendation of the appropriate agencies, health agencies in the country.
We will submit to the wisdom of the
That is my
Madam Chair. Thank you.
support to our proponent of this particular measure, Congressman Tambunting.
Thank you. Thank you, Chair Go. Before we proceed, Chair, i-recognize po natin ang another member of the
Yeah,
Committee
please.
on Health.
Yes.
We have a representative, Honorable Jane Castro of the Second District of Capiz. Ma'am,
Yes.
good morning. Yes, Chair, you can proceed. Any further clarifications?
Yeah, I think I just want to clarify the statement indicated in section 2, which is actually an amendment to section 7 of Republica 11332.
Yes, thank you so much, Chair. May we proceed to the other resource persons who might have also their manifestation regarding this bill from the Department of Budget and Management. May we call on Ms. Yvette Kong. Is she around? Yes. Thank you. You may proceed.
Good morning, Madam Chair, and to the honorable members of the House Committee on Health, as well as to all resource persons present today. I am Yvette Maclang po from the Budget Information Legislative Service of the DBM. Madam Chair, while we are still studying the provisions of the proposed House bill, the department recognizes its intent to amend RA 11332, notably including salient provisions such as the establishment of subnational laboratories in all DOH-run hospitals, DOH-run regional hospitals, and the establishment of epidemiology and surveillance units in the LGUs, as this seeks to enhance diagnostic and testing capabilities, ensuring timely detection and management of diseases. Additionally, this will also strengthen the government's capacity to monitor, investigate, and control public health threats effectively, especially in the local level. On the provision to establish subnational laboratories, may we kindly note that the position, classification, and organizational structure of this be subject to the review and evaluation of the DBM. And as for the management and operation of these, may we kindly defer po to the DOH on the matter. As for the provisions to establish epidemiology and surveillance units in the LGUs, it is understood that this will be operated and supervised by the local government units concerned. In this regard, we would like to defer to the League of LGUs on the matter po. That would be all for our initial comments, Madam Chair, and we will provide more insights po in our finalized position paper for the consideration po of the committee. Thank you very much po.
Thank you so much. May we now call on and proceed to may we call on Mr. Robin Lim once again from the Department of Interior and Local Government.
Thank you very much, Madam Chair, and to the honorable member of the committee. The department welcomes this development on amending the previous the existing law. While we are still going through with the proposed amendments, may we just want to highlight a few things. Number one, we are in support that all local government units must establish their respective local epidemiology and surveillance unit with career positions. With career positions of disease surveillance officers and other health related professionals, because we have learned this from the pandemic, from the COVID-19 pandemic, that we lack these health professionals, and we actually mobilize several local functionaries to firm up the contact tracing operations. In addition to that, Madam Chair, I would just like to bring your attention to the proposed amendments, particularly on item I, that the DOH shall establish hotlines and other forms of access where the public can report notifiable diseases and health events of public health concern. It is just a humble suggestion to the committee that maybe want to consider integrating such system of reporting these diseases to the existing hotline numbers of the local government units, so that all of the community can actually report it to not just to the DOH hotlines, but to the existing hotlines that our local chief executives have actually established. That includes the 911. And with that, it is humbly suggested that the DOH shall create or develop guidelines streamlining that integration process on how this reporting system through calls may be enacted. With that, Madam Chair, and to the body, the department will submit its official position paper. Thank you very much.
Thank you so much, Mr. Lim. Do you have any clarification, Chair Go?
Yeah, well, this is not a clarification, but the concern of the ILG, as stated, is already included in the letter I of the proposed amendment. As it says here, the DOH shall establish hotlines and other forms of access where the public can report notifiable diseases and health events of public health concern. So nandun na yun, and other forms of access. So that would address your concern, if I may interpret the provision as indicated in this proposed House Bill 3863, Madam Chair.
Thank you, Chair Go. Would you like to respond, Mr. Lim?
Yeah, thank you very much, Madam Chair. The DILG respectfully submits to the guidance of the honorable congressman. Thank you.
Thank you so much. May we proceed to call on our representative from the League of Provinces of the Philippines. May we call on Ms. Angelica Sanchez, our Policy Development Director.
Good morning, Madam Chair. Good morning, Madam Chair, members of the Committee on Health. So, Madam Chair, the League of Provinces of the Philippines support the amendment of RA 1132. However, Madam Chair, we just have certain points. We would also, with deference to our colleague from the DILG, we would like to take a different position regarding their proposition for a plantilla positions for the members of the local epidemiology surveillance unit. Because firstly, Madam Chair, we have a provision in the local government code that limits the spending for personal services to 45 to 55%. So, Madam Chair, unless there is such a position under the position classification of the DBM, we will have to oppose any creation of a new position, especially if it mandates the creation of a new plantilla position. And then, secondly, Madam Chair, in terms of relative to Section 8, Section 3 for the amendment of RA 1332, for the amendment of Section 8 of RA 11332, may we request a provision there which provides that the DOH shall provide support through the HFEF for the procurement of, especially for the procurement of logistics, and laboratory supplies, Madam Chair, because I think this is going to be one of the challenges to be faced by lower income LGUs. Because aside from the personnel, they also have to equip the ISUs. So I think we will be needing really the help of the DOH here, maybe probably through the HFEF hospital facility, at least the HFF program somewhere. It's in the bill that the DOH can help, because I think with the amendments, what is here is that the LGU SUs will have to be independent from the DOH. So at least just a provision there, Madam Chair. So thank you. That would be all. We shall be submitting our official position paper.
Thank you so much, ma'am. Your observation and comments are noted. Maybe now, is there anyone else that I haven't mentioned and recognized?
The League of Cities, Ms. Reggie Santiago.
Ms. Reggie Santiago, the program officer from the League of Cities, do you have any position?
Thank you, Madam Chair. While the league does not yet have an official position on the matter, hearing our esteemed resource persons and recognizing the vital role of local government units in alongside the DOH as its first line of defense on epidemics and health events, I will be sure to elevate the matter to our principals and seek their support on this House bill. Additionally, I would just like to support the previous manifestations of the esteemed Representatives Solon and Go that local governments provide a critical role in quickly diagnosing or testing these potential diseases. The proposed amendments to Section 6 of Number 6 and the House Bill encourages LGs to establish their own laboratories and partner with private hospitals. We hope for the ample support from the DOH and the RITM in the capacitation and establishment of these laboratories specifically, because these on a note po, the funding for these laboratories will be quite large, especially for lower income local governments. So that's something that we would like to keep an eye on, hope for the support of the DOH on the matter. Similarly, we also express support to the position of the LPP that we might have to oppose regarding the manifestation of the DLG in creation of new plantilla positions with the for ESUs. Just also to support the manifestation of the provisions for the personnel cap. That will be all, Madam Chair. Thank you.
Thank you so much, ma'am.
Madam Chair, may I propose in response to the comment of the DILG and the League of Cities and Municipalities, because it says here all provinces, cities, and according to the data submitted to the LG, only about 64% have this epidemiology and surveillance unit, no? So I would propose that in clustered or in areas where there are small municipalities, they can cluster themselves and have one only for one or two or three or more ESU or ESUs in these areas. So instead of putting all, baka hindi kaya yan, pwedeng tanggalin na yung word na all and we'll do an amendment to this amendment proposal so that we can address the issue raised earlier that because small cities might not be able to fund this ESO, no? And at the same time, because of the limit on the 45% as mandated by law, they might not be able to put up, plantilla positions for this. I'm sure our proponent will be amenable to that.
To Chair Go. To proceed, may I also call on a representative from the Philippine Statistics Authority, who we call Attorney Jefferson Biado. You are recognized.
Good morning, Madam Chair, and to the honorable members of the committee. The Philippine Statistics Authority, as the major agency in charge in the collection and processing of statistics, fully supports the passage of the bill amending RA 11332. As far as the fourth objective is concerned, which requires all public and private institutions to provide the necessary information in disease surveillance and other epidemiologic investigations, the Philippine Statistics Authority, this objective is within the scope and functions of the Philippine Statistics Authority, Madam Chair. We will submit our official position paper. Thank you.
Thank you so much, Attorney Biado. May we now call on once again Attorney Annalisa Duran to have a further discussion on this bill.
Thank you, ma'am, Madam Chair. We were just looking into one section, and we will be providing our specific recommendations po after the hearing today. Thank you po. Section
Ano yung concern yun na section?
Section 3, under Section 8. Section 8 of
Yeah, all provinces, cities, and municipalities.
yes po.
Mhm.
Regarding the word all, so we will be discussing this on the level of the Department of Health regarding the provision of the trained required human resource complement, which here it states all provinces, cities, and municipalities shall establish their ESUs, which shall closely coordinate with the ESUs of the Department of Health. So going back to the Department of Health after this hearing, we have to assess the ability to establish all of this in all provinces, cities, and municipalities. And we will therefore give the recommendation after. Thank you, Madam
Yeah.
Chair.
Thank you, Attorney. Yes, Chair Go.
Madam Chair, the suggestion I made earlier is we'll remove the word all because the suggestion that I made earlier, there might be some municipalities that are close with each other. Instead of having one ESO per municipality, they can have several municipalities with one ESO. So that's the suggestion to address the concern raised not only by the Department of Health, but also by the different municipalities and cities, as well as DILG as an entity. So if that would answer the concern.
Thank you so much, Chair Go. Yes, Dr. Jurna, Department of Health.
Okay, Madam Chair, in relation to the number and percentage of local government units as to their functionality, based on the current data as of 2024, that we will also be submitting officially to DILG. We have seen a significant improvement from 2023 to 2024. Now, our initial data now is we have at around 79.8%. So we hope that we could sustain that and even improve to a higher, since looking into the the need of the law of notifiable diseases based on the emerging diseases that we have, and based also on the burden of the disease that we have, based on Cat 1 and Cat 2, there's really a need, Madam Chair, to assist and fully support all the local government unit so they will be able to really function even at the first line of defense to detect and notify. So we will be submitting officially through the ILG the seal of local good governance as the result of our validation. So we are now at 79.8% from 2023 that we are only at 60. So that's the progress, Madam Chair.
Thank you so much,
So-
Dr. Jerna.
Yeah, therefore, I would suggest that the ILG and DOH should reconcile their numbers because the ILG is saying 64.7%, while DOH says it's 79%. So, but still,
Yes,
yeah.
thank you, Chair Go, the ILG and DOH. Maybe you could reconcile your statistics, your numbers, so we can have the exact numbers that we need. And before I move to the next resource person, bottom line, we cannot discount the fact that most of the diseases that are in our country actually came from outside of the country. Diba? It will not be here if it did not go in of the country. So definitely, it is very crucial that the detection also should be concentrated primarily from the Department of Quarantine, from the Bureau of the Quarantine. Diba, detection there is early on, makita mo na kung, I think we need is this for better technology? Because more often than not, they pass through our quarantine eh. Sabihin natin na hindi natin na-detect yung fever immediately. How is this? Mauuna ba dapat si ITM, si DOH ba? Sasabihin niya si DOQ? Or quarantine muna, may pumasok dahil dito. Who gets the information first? From your end and your departments, do you inform the Bureau of Quarantine to watch out for incoming diseases that will be coming from the other countries? Definitely, di ba, World Health, di ba, manggagaling yan, and then DOH will get the information. DOH, do you have the people who will be informing our Bureau of Quarantine to watch out for people manifesting all these symptoms? Bureau of Quarantine, may I recognize once again Dr. Roberto Salvador to respond to this. Thank you so much.
Good morning again, Madam Chair and honorable members of this committee. So the Bureau of Quarantine mandate po is to protect the country against these international health threats po. So we have our own system po of detecting and surveillance po, our international health surveillance po. So sabi ko nga po kanina, every day, kumukuha po kami ng data internationally. So pag po meron kami nakuhang mga data na pwede maging threat dito sa country, pwede pumasok, we inform the DOH po through secretary, and we advise our airports and ports po to be vigilant with this kind of diseases po. So continuously po talaga pong ang Bureau of Quarantine po ang first line of defense against these international health threats po.
Yes, Doctor. Doctor, Dr. Salvador. Anyway, your position on regarding the bill, may we have it for our author?
Yes po. Thank you po. The Republic Act 11332 or mandatory reporting of notifiable diseases has been an important instrument in our fight against COVID-19 pandemic. It was used by the Bureau together with RA 9271 or Quarantine Act of 2004 to ensure control measures conducted at our national borders are legal, protective of the common goods, and respective of individual rights. So we fully support po the amendment of RA 11332. Thank you, Madam Chair.
Thank you so much, Dr. Salvador. Yes, may we recognize Representative Castro to give her
Jane
comments.
Castro, yeah.
Yes.
Yeah, we have heard the suggestion from the League of the Provinces, Miss Angelica Sanchez, regarding the requiring the DOH to supply the required machines or equipments, because we can hardly, of course, rely on our municipalities to provide that. And of course, it is DOH which is more knowledgeable on this equipment. So can we add that in this provision, that to require the DOH to at least supply the required equipments and machines?
Dr. Jerna, would you like to respond to her query?
With regards to the laboratory supplies, as well as those expressed early, Madam Chair, um, as as part of the process in terms of
I'm asking for the equipments and machineries. The laboratory supplies, it's manageable, I think, but the equipments and machines.
Honorable Chair, Madam Chair, we will take note of this additional provision of the amendment, and we will discuss this, ma'am,
Yeah,
with the Department of Health.
yes,
Okay.
thank you.
Thank you so much. Rep Castro, do you have any follow-up queries for our resource persons? Wala na po?
No, it's my question will be under section 4 na.
Yes po, you may proceed.
Okay, okay.
Yes, Rep.
So we have in section 4, we have under section 9 prohibited acts. All this is I think there's no penalty that will deter or prevent or reduce these prohibited acts or annoying acts, no, from happening. Any suggestion as to the penalty that should be included here in this provision?
May we ask the author for your comments on her question?
I'm sorry.
The
A penalty for this prohibited act, so
section 9 prohibited
that
acts.
will reduce, prevent, or prevent.
I definitely would be more than willing to agree to the penalty as long as it is within the legal framework. We should also take in consideration the existing law. For example, does it provide a penalty? So, then
Yes, Rep. Pumbunting, we have it in section 10. Rep. Castro, the penalties are indicated in section 10.
In this paper that is so hardly cannot read it. Here, is it here?
medyo malabo eh. Ma'am, Madam Chair,
Thank you.
Madam Chair.
Thank
Yeah,
you, the Honorable Marco.
yeah, it's actually in section 10 of Republic Act 11332. And the amendment does not propose any change in the penalty. Yes, so automatic ito.
That's the reason why I asked.
Yeah,
Because if there's already an existing
yes,
provision, then there's no need for me to include one in
Yes.
my proposed bill. Thank you.
ito ma'am, under section 10 penalties, any person or entity found to have violated section 9 of this act shall be penalized with a fine of not less than 20,000 pesos, but not more than 50,000 pesos, or imprisonment of not less than 1 month, but not more than 6 months, or both such fine and imprisonment at the discretion of the proper court. Yan po yun. Hindi na po,
There's no
because
need not
this is just an
to
amendment to the
The
certain
existing
provisions.
one
Yes,
was reading.
yes, ma'am.
Okay, thank you.
Yun. Ayun.
Okay.
Ah. Okay, Madam Chair, if there are no more concerns, issues, and manifestations on this proposed Bill 3863, I would like to move that we approve House Bill 3863, an act amending Republic Act 11332, otherwise known as the mandatory reporting of notifiable diseases and health events of public health concern, subject to style and amendments. 3863. 3863.
There being a motion, there being a motion duly seconded for the approval of House Bill number 3863. How about its committee reports? Yes, subject to style and amendments, including its committee reports. House Bill number 3863 is approved.
Madam Chair, I would also like to be made a co-author with the kind indulgence of the author, Representative Gaston Bunting.
Thank you very much, Madam Chair, of course, and may I request that all members present in today's hearing be included as proponents of this measure. Thank you.
Yes, there being a motion on that, and that for all our members present here in this hearing, be made co-authors of the said bill, duly seconded, that motion is also approved.
Maraming salamat po, Madam Chair.
There being no other matters, may I have a motion?
Madam Chair, I move to adjourn.
This meeting is now adjourned. Thank you so much for everyone.